With mounting cases of lung injuries and deaths associated with vaping, there is plenty of concerns about the health impacts of e-cigarettes.
Many are using e-cigarettes as an alternative to smoking, but what kind of effects can it have on fertility or even pregnancy?
Those are good questions, and morning anchor and health reporter Kirsten O'Connor is standing by with a fertility expert in today's Ask a Doctor.
Well, studies and health officials have pointed out there are significant negative health effects from vaping. And with the rise of the vaping epidemic, the talk of fertility is important and timely. So joining us now is Dr. Mark Trolice of Fertility Care in Winter Park. Great to have you back on the news 6 at 9.
Always a pleasure. Fertility is my life. You know that, Kirsten.
That's right. So what can you tell us about vaping and fertility, especially with men?
Well, vaping is taking off. And I think that there's such a misperception and a misconception, no pun, that vaping is safer than tobacco and cigarettes. And it's really not. We don't know enough about it to say that, clearly. There's a lot of nicotine and comparable amounts of nicotine in vaping and in cigarettes. So the vaping for fertility purposes, a study just came out in Journal of the Clinical Endocrinology and Metabolism. And it looked at mice that had longer times to conceive. They actually had vaping with the mice, if you can imagine that. So they had longer times to conceive, decreased implantation of the mice, and the fetal DNA in the mice were affected that could have long-term consequences like immunologic and cardiovascular and neurologic. So vaping is not a safe thing for fertility at this point, and certainly not during pregnancy as well.
And like you mentioned, there are just so many long-term consequences that we don't know yet about vaping. One of those things has to do with, just young people vaping and maybe not ready to conceive, not ready to start a family yet, but what their chances would be like in 10 years.
Well, vaping also could have long-term consequences, lungs and heart disease. Secondhand vaping has also now been shown to be affecting the health of the people that are inhaling those particles that are aerosolized particles that are going out into the air. So it's not a safe thing to do. And you have to consider the nicotine in the vaping with the risks for tobacco use, and we can't underscore that. Tobacco use is, 1 out of 4 to 1 out of 5 women don't realize that tobacco use increases infertility, a tubal pregnancy, ectopic pregnancy, and earlier menopause up to 4 years. So tobacco use clearly decreases fertility, reduces sperm counts in men, can cause birth defects, miscarriage. So the type of things that you use for recreational, there are safer things to do to reduce stress, if that's what you're doing it for, like yoga, meditation, exercise. But I would hold away from vaping and certainly cigarette smoking.
And I'm sure a lot of your patients have been asking questions about the vaping because it is so popular right now. You're getting, an influx of it right now. What can you tell us specifically about implantation? Because that's something you mentioned. And can you explain what that is, first of all, and how your chances of implantation will change due to vaping?
Right, so what implantation is when the embryo, after the egg has been fertilized in the fallopian tube, the embryo travels through the fallopian tube and implants into the uterine cavity about 5 to 6 days after ovulation, naturally in women. So the embryo snuggles into the lining of the uterus, and that's called implantation. So what they found in that mouse study is that was what was affected. They had the decreased percentages of those mice that were implanting, and they had longer times to pregnancy.
And what about for men specifically? I'm sure guys are looking at this type of a study thinking, well, I'm not trying to get pregnant right now anyway. How would this help or maybe decrease their chances of becoming a father?
Well, the nicotine, as I said, in vaping is comparable to that's in tobacco. So that affects sperm counts, okay? It may increase the risk of birth defects. If you think about the amount of smoke that's available, as I said, it's not just in the original user, the individual user, it's also secondhand smoke. So it's going to impair fertility for the man and the woman.
And so that goes for dads, too, who already have kids in the house who need to be thinking about secondhand smoke.
Absolutely. Responsible parents are going to keep that away from the children. And to be as healthy as possible for your children, you want to obviously not do it.
So, doctor, would you treat vapes just like cigarettes when you're talking to your patients?
Yes, absolutely. Excellent question, and a perfect point to end on is that cigarette smoking and vaping should not be done by people trying to conceive, and certainly not during pregnancy. But for health reasons, you don't want to be doing that anyway.
All right, Dr. Trolice with us. Thank you so much. We'll send it back to the ladies at the desk.
All right.